The highlights of the past year. Our spiritual outreach, first and foremost, the primary school Bible class program has really produced fruit this year in the kids. They actually are growing, and it's really changed, especially the lives of the older kids. I enjoy sharing our morning devotions, and it's well attended. We have about 50 every morning for morning devotions of our staff. It's great. We also have opportunity to have sporting meets, and I was asked to speak at a soccer tournament with a whole bunch of teams from the area. It was fun getting these guys. And then every year now, for the past 3 years, we have the half marathon, and the people really enjoy coming to that. And same guy's won it every time, but that's fine. He's now hired as one of our local staff members. We also have a monthly outreach to the areas around Kuranda to show the Jesus film and other ministries as well. And then, of course, the hospital. This year, actually just about a month ago, we began a joint venture with FIBA. It's Far Eastern Broadcasting Association, but in Africa. We are working with them to produce Bible programs for the hospital and then broadcast it to the hospital and to the area around. We're going to take it slow and see if we can go beyond just the hospital setting and in the station setting to area. Of course, the chaplains also are very, very busy. This past term medically, I've been excited. We had a pediatrics department. We actually built a new male ward 2 years ago and opened it. And then I moved pediatrics from, which is behind our operating rooms, down to where male ward was. And then I turned the old pediatrics into a new operating suite. So I added 2 more operating theaters and 2 procedure rooms and an office for myself. I wasn't going to have the office, but I wanted my office for storage, so that I moved it. And it's really nice. I have my own coffee pot and everything. It's really a nice office. So now I have in my own surgical suite where I have endoscopy and my cataracts I do there, and ultrasound scanning, which I think Southwestern bought the ultrasound scan for me. It was great. And we also do all of our casting there as well. So it's been really fun. I have my own surgical suite, outpatient suite. It's called day surgery, so that's been great. The endoscopy, I decided I was tired of having people paying for scopes. We couldn't do any biopsies. We couldn't hardly see anything. So I went and bought brand new equipment. We have state-of-the-art endoscopy equipment for both upper and lower. Also, because in the past 25 years, Dad can confirm this, we have had almost no colon cancer in Zimbabwe. This past year, I've done about 15 cases. So we have a lot of urban people coming out to Kuranda. The diet has changed, and we are seeing a lot of colon cancer. So we had no way of seeing it before. Now we can get it at a reasonable stage by doing colonoscopies on them. So with my father gone, he was doing all the orthopedics for years and years. But you know, God always provides at the right time. He doesn't come early. Generally, we didn't chase him away. As soon as Dad left, Ryan, who was a medical student years ago at Kuranda, went on to do orthopedics and really wanted to come back and share with Zimbabwe, actually. He wanted to work in the central hospitals as well, in Perry and Harare Central, but he also wanted to bring the Sign Nail program. Many of you probably have heard of the Sign Nail program or not. It's a program to put IM rods, intraventricular rods, into patients without the use of the C-arm. It has a guide arm, so you can just make this thing all together. You put the arm on, and then you put it down, and using the arm, you can find the blocking holes in the nail without having to use X-ray. So that program came just after Dad left, and I've done 150 bones now in the past year and a half. So that's been great having that program. Also, we've been very, very involved with hydrocephalus. We are probably the major center for treating hydrocephalus in the country. We do one almost every single day, or more. Average of about 200 a year of hydrocephalus. Either new shunts, we do about 120 new shunts, and the rest of revisions or block shunts or having to remove them. So a lot of that. And I was approached by a couple in California to go to Uganda and to be trained in EPV. I'm not sure, once again, I don't know how guys do it. It's endoscopic transcerebral ventriculostomy. It actually cures hydrocephalus instead of having to use a shunt. So he'll pay half the cost, which is $100,000. He'll pay $50,000 of that. And Cure International, who puts on the program, might help some, but you're trying to raise the other half. But it actually cures 75% of the babies with hydrocephalus. The other 25% you have to shunt. Part of the $100,000 involves the equipment, which is probably about half the cost is the equipment. We also have Dr. Paul Thistle. He came to us from Howard Hospital, which is a hospital in our same province. He'd been there for 16 years, had a run-in with his parent organization, the Salvation Army, and I decided to leave them, or was forced to leave them, but he didn't want to leave the country. So we hired him, and he became part of TEAM, and he's very involved in cervical cancer screening. He has one of the foremost programs in the country now. We have the highest incidence of cancer of the cervix in the world, in Zimbabwe. And we see a lot of cancer of the cervix every day, 2 or 3. It's incredible. But we've been able, with his program, to see them earlier and able to treat them surgically when they're stage 1, stage 2, instead of having to just biopsy them, send them to Harare for radiation, which they never get. The machines are always broken, it's pointless. But if we can't cure them, we can really palliate them by surgery, especially if we can get them earlier. And he's the one who I'm having you all provide funds to get the colposcopy unit and a cryotherapy unit. He also does LEAP, but out there, cryotherapy is more expeditious often than the LEAP program. This past year, we've also had a number of other things. We used to always buy oxygen from Capital City. We send tanks in, get them filled, and bring them back out. Tanks now cost $200 each to get filled. So we had an anesthesiologist come from Texas, and he decided to give us oxygen generating program. So we actually make our own oxygen, same level that they do it in town, fill these big tanks and do that. So that's been great to have that program. We are very involved with the University of Zimbabwe, training their surgical interns. We have 2 all the time there. They come out to us for 3 months and really help out in the outpatient department, but they also get exposure to surgery, and so both. They see the surgical patients pre-op, they help us assist them, and they see them post-op. So we've been doing that now for about 2 years, training their interns who are doing the surgical rotation. And we're still involved with the medical students as well. And plus we have overseas medical students come out. Our needs, we always need internal medicine people, family practice people. A pediatrician would be really nice. We need help with the outpatients. We see around 75 to 100,000 patients a year. We have, with the surgical interns, we have 6 doctors, well, 5 and a PA, but 2 of them are brand new, just out of medical school. So it's real helpful to have professionals, to have people who have experience working with us. And this year, we are not doing any orthopedics besides simple casting or traction. And I found traction isn't the best for a lot of things. And it would be nice to have ophthalmologists as well. So those are the surgical needs, is orthopedics, eyes, always a second general surgeon, especially if Stacy only stays for 2 years. So God's been really good to us this year. It's exciting. The place is looking great. And it's a real privilege to be part of this work at Zimbabwe.